Hello, everybody. I'm Michael Barasch of Barasch McGarry, and I'm delighted that you've decided to spend a little time with us this afternoon. This is Esophageal Cancer Awareness Month. I want to introduce some of the people who you're going to be hearing from. My partner, Dom Penson, my other partner, Dana Cohen, my associate, James Steiner, my partner, Lee London, and Dr. Jeffrey Koo of Sloan Kettering is right there as well. And we're honored to have you with us today, Doctor. Thank you so much. Before we start, I want to thank our friends at the Esophageal Cancer Education Foundation who've given us a 2-minute video to show, and we're going to start out with that. I also want to thank Cancer Care, the American Cancer Society, the Esophageal Cancer Awareness Association, the Cancer Action Network for spreading word about this webinar and helping us get the word out about the July 29th deadline that you're going to be hearing about shortly. The bottom line there was that this is treatable. And what a perfect segue to you, Dr. Q. Thank you again for joining us. Please tell us a little bit about this illness and this disease.
Yeah, thank you so much. And actually, I think first of all, I want to thank you for the invitation. And I think the video set things up very well. This is, at the end of the day, thankfully an uncommon cancer, but because it's uncommon, I think the first step really is awareness. And in the next 10 or 15 minutes, I'll talk about some symptoms that really one has to be aware of that are not typical, that really requires medical evaluation. So by way of introduction, esophageal cancer is really quite uncommon. The numbers here are updated from the video, but a little bit less than 20,000 people will be diagnosed in 2021. To put it in perspective, the most common cancers, things like prostate cancer, breast cancer, those are diagnosed in more than 200,000 people each. So really, this is about 1/10 as common as the most common cancers. Having said that, I think something the video alluded to is that for many, many years, cancers that are at the junction between the esophagus, which is really just the food pipe, and the stomach, what we call the gastroesophageal junction, that's actually increased in incidence since the 1970s, especially in men. And why that is, why that could be, I'll talk about when we discuss the risk factors. So under the microscope, there actually are two kinds of cancer cells that we can see. The much more common kind is what's called an adenocarcinoma. And that basically just refers to cancers that arises from glandular tissue. So, most cancers are adenocarcinomas, including breast cancer, prostate cancer, lung cancer, colon cancer. The much less common kind in the US is what's called a squamous cell cancer, and that's only about one in 4 patients with esophageal cancer. But ultimately, a major problem is that because this is an uncommon cancer and we don't screen for it in the US, for example, unlike colonoscopies, mammograms, pap smears for other cancers, unfortunately, 1/2 of patients are actually diagnosed with metastatic disease where the cancer has already spread. And as I'll talk about at the end, that really has great implications in terms of the prognosis. So I'll start by talking about risk factors for squamous cell cancer of the esophagus. So that's a less common one. And the main risk factors are right up there at the top. It's really alcohol and tobacco. So thankfully, as both kind of alcohol, excessive alcohol drinking, as well as smoking in the U.S. have gone down, this has really become a much less common cancer. On the other hand, in many places in the world, including East Asia, Eastern Europe, actually even France, this is actually the more common form of esophageal cancer. Now, by far, the one that's the most common, I think probably most relevant to today's talk, is the adenocarcinoma. So again, these are the risk factors here. Tobacco is only a weak risk factor, but one risk factor, which I think the video mentioned as well, is actually obesity. And we think that obesity can work in a couple of ways. With increased obesity, there actually is more pressure in the abdomen, and that kind of pushes acid from the stomach up into the esophagus. So in other words, obesity leads to an increased incidence of reflux disease. And reflux disease, in turn, leads to something called Barrett's esophagus. So the acid, kind of chronically irritating the esophagus leads to changes in the esophagus known as Barrett's esophagus. And people who have Barrett's esophagus are then at a low risk of developing esophageal cancer. And it's really patients with Barrett's esophagus who potentially need frequent endoscopies to keep an eye on things to try and detect the development of a cancer early on. So this is probably the most important slide. And I think these are symptoms that everyone needs to be aware of. So difficulty swallowing, the medical term for that is dysphagia. Difficulty swallowing should never be a normal symptom under any circumstance. And many people describe initially having difficulty swallowing solid foods. So commonly someone eating a piece of carrot or broccoli or a piece of steak, they'll feel that gets stuck. Whereas, liquids and water and soup and things like that go down. A related symptom that really should send off, kind of alarm bells is pain swallowing, which is called odonophagia. Again, you should not have pain, swallowing any consistency of food. Related to this are people, who lose weight without really trying, or who lose more weight than anticipated, having a sensation of pain or discomfort in the middle of the chest. And then I think as the video suggested, reflux symptoms. But reflux symptoms is tricky because, certainly at this point in time, there are millions of people in the US who have, reflux symptoms and gastritis and heartburn. So thankfully, very few of those people have or will eventually develop esophageal cancer. So the bottom line is that certainly not everyone who has reflux symptoms needs an endoscopy right away. But I think if someone is having persistent reflux symptoms, they're popping Tums all the time, they're taking over-the-counter antacids, it's certainly important to discuss that with their primary care physician, even in the absence of the other symptoms. And I think in conjunction with their physicians, I think they'll then make a decision about whether starting with some antacids to treat this makes the most sense, or indeed whether some other testing is required. Now, in terms of testing, this is kind of the workup for esophageal cancer. So frequently, a test that many people will be will go through when they begin to have symptoms like this is what's called a barium swallow, and that's really where someone swallows a dye that's radio opaque that shows up on an X-ray. They then basically have a series of X-rays that kind of show up the outlines of the esophagus, and that sometimes can show if there's a blockage or if there's a mass in the esophagus. To me, that test actually has limited usefulness because to some degree, no matter what you see on a barium swallow, ultimately the gold standard is it's what's called an endoscopy. And this cartoon shows what an endoscopy involves. Basically, if someone is put to sleep during an endoscopy, they're given medication to make them drowsy. A tube with a camera is then inserted in through the mouth, into the esophagus and into the stomach. And the value of this procedure is that you can see exactly what's going on. And if you see something there that's abnormal, whether it's irritation, whether it's this Barrett's esophagus, or whether it's a tumor, you can biopsy it and then know in black and white exactly what you're dealing with. Post-endoscopy or after endoscopy, if a diagnosis of esophageal cancer is strongly suspected or it's been made, most patients will also undergo a CT scan or CAT scan. I think most of us are familiar with what this is, but basically it's a computer kind of created X-ray images, which really allows us to see exactly what's going on. Sometimes in addition to a CAT scan, what's done is also a PET scan. PET scan has the value of lighting up where the tumor cells are, and that sometimes allows us to better stage the cancer. So I'm clearly going to talk about this in very brief detail only, but in terms of treatment, the big delineation, in esophageal cancer and indeed in kind of all solid tumors is between a localized cancer that's not spread and a metastatic cancer that has spread. And because that really delineates to us what is curable versus what is treatable but not curable. So only if the esophageal cancer has not spread is it curable. And in that context, surgery is the most important part of treatment in terms of cutting out the tumor. But for esophageal cancers, we typically give either a combination of chemotherapy and radiation together, what we call chemoradiation, or chemotherapy. And we normally do this prior to the surgery, both to facilitate the surgery, but also to treat any microscopic cells that may have escaped. There have been significant improvements in the treatment of esophageal cancer, actually even in the last 6 months. So now actually there's a role for giving immunotherapy after surgery. Immunotherapy medications are drugs that stimulate the immune system. So the immune system wakes up, recognizes, and is able to attack cancer cells. Immunotherapy probably is, the biggest advance in the development, in the treatment of cancers, certainly in the last, 20, 30, 40 years. On the other hand, if the cancer has spread, if it's now metastatic, it's generally no longer considered curable, but it still remains absolutely treatable. And when the cancer has spread, surgery no longer is generally not an option anymore. And really chemotherapy becomes the main treatment. But rather than chemotherapy being given for a finite period of time, it really is given indefinitely for the remainder of someone's life. And the goal at that point is to shrink the cancer, to control the cancer, to reduce symptoms from the cancer, and certainly to significantly extend someone's lifespan. And just as immunotherapy now has a role in localized cancers, there is also now a role to combine immunotherapy with chemotherapy for patients when the cancer has metastasized. So with that, I'll stop. And again, I thank you kindly for your attention, and certainly we'll be very happy to take any questions later on.
All right, so let's go on now to a short video that we did a presentation at the Borough of Manhattan Community College. We were very lucky that our hero, Jon Stewart, was with us, Senator Gillibrand, and a number of other people. And they're going to hear you're going to hear a message loud and clear, which we are hoping that even if you are already signed up with the health program and the Victim Compensation Fund, that you will help us spread to your friends, your neighbors, your colleagues who may not yet be signed up.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you. Let's go right into our first slide. You saw this map. You saw Senator Gillibrand talked about it. For reasons that are just don't make any sense at all, when Congress passed this bill back in 2011, they made 2 separate boundaries. One is below Houston Street, and anybody who's south of Houston Street and in Western Brooklyn is entitled to the benefits of the World Trade Center Health Program for the rest of your life. But sadly, while 80% of responders have enrolled, mostly because their unions have done a great job educating them, only 7% of the non-responders have enrolled so far. So that's our big message to asking you to help us spread this message. You are entitled, as Jon Stewart says, to these benefits, and they're free. Anyone who's been certified by the health program with a 9/11 illness, and as you'll hear, they've linked 68 cancers and many respiratory illnesses to the toxins. Well, if you're below Canal Street or at the Fresh Kills landfill, you're also entitled to compensation. Let's start with this. James, would you take us through this slide and talk about some of the most common cancers?
Absolutely. And this is very important. There are so many illnesses that have been linked to World Trade Center exposure. Of course, you've heard GERD, Barrett's esophagus, esophageal cancer. These are some of the more common gastrointestinal conditions, but there are also many illnesses that are cancerous and also non-cancerous, which have been linked to the specific toxins that were exposed to, of course, the first responders, but also what's are considered survivors, which are students, office workers, teachers, and residents who were in Manhattan below not just Canal Street, but also Houston Street. So some of the most common illnesses that have been linked to exposure, as you see here, are skin cancer, which includes basal cell and squamous cell skin cancer, and also melanoma, which of course is more serious. As far as cancers go, in men, the most common is prostate cancer, and then women, breast cancer. What's interesting about cancers in the 9/11 community is that breast cancer also does affect the male population more commonly than outside of the 9/11 community. You also have blood cancers, including lymphoma, myeloma, and leukemia, as well as other solid cancers of the organs like lung, kidney, and colon. With 9/11 exposure, you also see a host of non-cancerous conditions. Typically, they're pulmonary in nature, like interstitial lung disease, pulmonary fibrosis, or sarcoidosis, but also respiratory conditions, upper and lower, including sinusitis, rhinosinusitis, and all of the like.
All right, thank you, James. There is a presumption by the National Institute of Occupational Safety and Health that if you have any of these illnesses and you were exposed for the sufficient amount of time, which I discussed in the video, the presumption is that it was caused by your toxic exposure. So please don't let doctors tell you, oh, you have a family history of breast cancer, or, oh, you used to smoke, so that's why you have lung cancer. Well, it certainly may have been a contributing factor, but the presumption, as far as the government is concerned, is that you are entitled to this free health care and you should take advantage of it. And if the health program certifies your illness, you're also entitled to compensation. Lee, would you tell us a little bit about the deadlines that our listeners should be aware of?
Sure. And thanks everyone for joining. So just in general, when the Zadroga Act was created, it was broken down into two entities. So you have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other. With the World Trade Center Health Program, it is medical benefits, yearly evaluations for the rest of your life. It is a hospital which we encourage, sick or not sick, to register for the programs, both the World Trade Center Health Program and the Victim Compensation Fund. On the Victim Compensation Fund side, there are monetary awards for different benefits that can, that we can make for somebody moving forward on a claim. Both programs have been extended to outlive everybody in the zone. And this program isn't just for people that were there on 9/11. Many companies shut down for 2 weeks and people went back into the zone after 9/11 and was in the zone for all that time, breathing in the toxic dust.
Well, wait a second, Lee, I have to interrupt you. Christine Todd Whitman of the EPA assured us all that the air was safe to breathe, didn't she?
Exactly. So it's not just for 9/11. They wanted to reopen Wall Street. So that's why a lot of people say, oh, I wasn't there on 9/11, but I went back in the zone 2 weeks later. You qualify as well. So we are just trying to get the word out because there are so many people that are suffering from these horrible conditions that don't even know these benefits are available. But going back to the deadlines that are approaching in July, Dom and Dana are going to speak more about the wrongful death deadlines coming up. But I just mentioned the word certification, and many people will not know what that word means. But if you're part of the World Trade Center Health Program already, and you've been certified for a condition, and it's longer than 2 years ago, once July 29th of 2021 hits, you can't move forward on a claim. So we are encouraging everybody, if you think you're certified, if you don't know if you're part of any of the programs, give us a call. We'll register you if you're sick or not, just to protect your rights moving forward. Dom and Dana will speak about the deadline for deceased claims, but just very fast and very basic. We were trying to get the word out to the retirees, the organization. People moved out of New York and moved away. Many people passed away longer than 2 years ago. So the VCF extended the deadline until July 29th, 2021. But after that date, if you know someone that passed away from prostate cancer in 2008, and their family doesn't know that they can make a claim, they'll be time barred by the time July 29th, 2021, unless you know someone. So you might not have been there, but if you know somebody that was there during 9/11, reach out to them, make sure they're aware of this information. It's just very helpful.
Thank you. Dana, would you talk to everybody a little bit about the benefits of the health program?
Yes, thank you. The World Trade Center Health Program, as Lee explained, is one of the two major programs that the government created for the 9/11 community. It provides free treatment and free medical monitoring for the 9/11 community. If you're a first responder, you get medical monitoring whether you're sick or not for the rest of your life. If you lived, worked, went to school downtown, if you were exposed, not as a first responder, but in some other way, you are also entitled to enroll in the health program. And if you get sick, you will get free treatment for your 9/11 illness. It's such an important benefit. The other major thing that the World Trade Center Health Program does is that it certifies illnesses for the 9/11 community. Lee talked a little bit about certification. That is the formal process by which the World Trade Center Health Program links your illness to your exposure. And once you have that certification letter, you will get treatment at the World Trade Center Health Program, and you will also be eligible for compensation from the 9/11 Victim Compensation Fund. The World Trade Center Health Program has facilities in every state, including in Puerto Rico. So you have to let the health program know where you'll be. So if you're going to spend the summer in Florida, you'll tell the program and they'll switch your care to Florida for the time that you're there. So you won't have to miss treatment. One of the things that we just talked about COVID and the way COVID affects the 9/11 community, there is another way that COVID affects the 9/11 community, and that is in keeping people home. And so maybe they aren't going to get their scans and their tests. And we want to remind you that that's dangerous too. please, go for the care that you need, go for the scans, go for the testing. Don't put it off just because we're in an unusual time. It can be done safely.
Thank you. That's such a good point. And I saw Dr. Kuhn nodding his head, so I guess he agrees.
Absolutely, yeah, yeah.
Dom, would you tell us a little bit, please, about the benefits of the Victim Compensation Fund for personal injury claims?
Sure. So if a person is deemed, if they have an illness that is deemed eligible for compensation, meaning, as Dana said, that the claim has been certified by the health program, and that victim becomes eligible for benefits, there is a range of awards for different illnesses that the VCF gives. You see it on this slide. For non-cancerous conditions, the awards range. This is for non-economic loss. I should clarify that the VCF gives out personal injury awards that include medical expenses, out-of-pocket medical expenses, that include non-economic loss, in other words, the pain and suffering associated with a particular condition. And if a person is disabled from employment, the VCF also provides economic loss awards. So the economic loss awards, of course, that depends upon what a person is earning. That's going to vary from case to case. Whereas with the pain and suffering awards, the non-economic loss awards, those tend to be standard, but again, there is some variation. If one person's condition is more severe than another, the award may correspondingly be higher. So for example, for prostate cancer, cancers typically get between $200,000, you see it on the slide, and $340,000. Because, well, at the low end, at $200,000, that would be for example, prostate cancer, where somebody does not have a lot of complications from the treatment. But if another person has more serious complications from the treatment, then the award may be higher. It can go up to $250,000. The VCF also recognizes that a person may have more than one cancer from their exposure, and that's why it goes. The awards go up to $340, because if a person has two cancers, they can get up to $300,000, and if they have three cancers, and sadly we have clients who have 2 and 3 cancers from their exposure, then the pain and suffering award associated with that can go up to $340,000.
All right, thank you. And Lee, would you please speak a little bit about economic claims, which are in addition to what Dom just talked about, which we generally call non-economic loss?
Sure. So many survivors, first responders, volunteers, their 9/11 related conditions, cancer and non-cancer. Michael in the beginning represented Jimmy Zadroga, who this bill is named after. He passed away from pulmonary fibrosis. So I just want to make sure people are aware that we want to get people into these programs when they don't have that oh my God moment. If they're suffering from a cough, from GERD, we want to get them in when they're suffering from GERD. So then if it does lead to Barrett's, and God forbid, an official cancer diagnosis, they're already in the program. They already have their documents together. So, we want to start them off when they just get that initial feeling something might be wrong. So then they're already in it. God forbid anything happens in the future. And why I say that is many times, my firefighter clients, my survivors, my Citibank employees that worked in the zone, they go out on short-term disability a lot because they're cancers. It's too much. And, it's a lot of treatment. Dr. Koo mentioned that there's chemo, there's radiation involved. So it knocks a lot of people out. They have to go on short-term disability, then long-term disability, then they can go on Social Security disability. The Victim Compensation Fund wants to make people whole again. So they do what is called an economic loss claim for loss of earnings, to make you whole again from the earnings that you lost while you were out. And they're very amazing with doing this. We have great appeal results as well, because many times we'll get awards in, we'll have our economists review it, we'll go over it, and we'll appeal it if we don't think it's fair to get our clients the highest amount that they're entitled to. It's an amazing program. Not only is there economic loss claims to be made, but out-of-pocket medical expenses. Many people don't get into the World Trade Center Health Program prior to their cancer diagnosis or suffering through their condition. So they have all these out-of-pocket medicals that wasn't covered by the health program. We can get that reimbursed to you directly through the Victim Compensation Fund as well, just because it's another benefit that they offer. We want people to take advantage of these benefits because you never know when something will develop. And
Lee, So Lee, I have to ask you, that's one of our questions from out there today, which is, I do have GERD, but I don't want to waive my rights in case, God forbid, I get cancer in the future. How do you respond to that?
We want them to register today, because if I get someone an award for GERD today, I can always amend their claim for an increased award. God forbid something happens in the future. You never waive your future legal rights. You can always move forward on a claim if the circumstance changes. So I can get you an award for asthma for $20,000 while you're alive. Someone else can get an award for asthma for $90,000 because they had 8 surgeries compared to the person that got $20,000 that uses a nasal rinse a day. And then if they get cancer 5 years from now, I can amend their claim for an increased award because of their cancer. If they lose their earnings because of it, I can amend their claim again for an economic loss award. So it's all about changing circumstances.
Dana, would you take us through some of the benefits of the and the deadlines for the death benefits?
First, I'll talk about the benefits that are available. The awards will in part depend upon whether the person who passed away collected anything during his or her lifetime. If that person didn't, the family will be entitled to collect those benefits on behalf of the estate. The family will also be entitled to wrongful death benefits. So all of the personal injury, non-economic loss, and economic losses that the person had during life that Lee and Dom talked about, the family will be entitled to get that back. In addition, the family will be entitled to lost earnings from the date of death through the person's work life expectancy, lost pension. The person will be entitled to something called replacement services. So the value of the person's services in the home, the things that we all do for one another to support our household, cooking, cleaning, yard work, it runs the gamut.
So Dana, are you telling me that somebody may be entitled to money as a separate item of damages because of the work that their husband may have done around the house?
That's right. That can be a very important component of the claim. When you lose a spouse, you lose that support person who helps you to really make life come along and work. And now you may have to hire somebody to do the repairs around the house that the person did, to clean, to cook. You may have to have groceries delivered. There's a cost that comes along with it, and the VCF recognizes that. The VCF will reimburse families for burial costs, which can be substantial. The families will receive an additional award for the decedent, the person who passed away, for their pain and suffering. That's $250,000. And the spouse and each dependent of the decedent will receive $100,000 each.
Thank you. Let's go on to the last slide. James, would you take us through a summary of what we've talked about today, please?
Absolutely. So the first thing is spread the word. It's our mission. Like Dom was saying, there is so much misinformation and a lack of information, especially to people who were not first responders and don't have unions to relay the updates in policy and the deadlines and the changes. If there's anyone you know who was exposed to 9/11 toxins, just tell them about the programs that are available. The second thing you could do is register for those programs. Registering now will not just preserve your right to file a claim down the road, it will also preserve the right of your family to file a claim on your behalf if, God forbid, something was to happen to you. Also, you heard Dom talk about warehousing your POP, your proof of presence documentation. Look, when things happen, people lose touch with their witnesses and their coworkers, and that's more likely to happen as time goes by. So use this time now as an opportunity to secure your proof that you were in the zone. And also see a dermatologist. Skin cancer quickly became one of the most common 9/11 related illnesses. And most people don't know that skin cancer is a 9/11 condition. And what's interesting is that for people who are in the health program, skin cancer is not part of your annual checkup. That's something that you have to see a private dermatologist for. Then if, God forbid, you were diagnosed with something, the World Trade Center Health Program would then pick up the cost of treatment and medication for your skin cancer. Also, get a will, make it easier on your family to file a claim on your behalf if, God forbid, something were to happen to you. And for people who live in New York, for our clients, we do free wills. So if you have questions about this or wills in general, just give us a call and we're happy to help you out.
That's great. Thank you, James. There's so much help available. Our firm is one of several that is always there for you. So please don't, just stand by and think that there's nothing I can do. There is something you can do. Anyway, Dr. Koo, I can't thank you enough for your time today. You were so generous, and I really appreciate you helping us get the word out there. It's such a difference when a doctor is part of this. Good night, everybody, and thank you for joining us. We'll send you this information. Please feel free to share it.